Hello. Hi there. Thanks everyone so much for joining, especially our guests from New York. Um, the senator should be on shortly, but in the meantime, if anyone has trouble recording, please let us know and we will do everything we can to fix that. Thank you. Hi everyone. Thanks again for joining. The senator should be on shortly, but in the meantime, let me know if there's anything from you need from us. Thank you.
Okay, I'm ready, folks. Can you all hear me?
Yes, we can hear you, Senator.
Great. Thank you, folks. And I'm sorry to be a little late and I'll have to be a little short because we got a lot going on the floor, as you know. Lots going on in Washington, and that's what this call's related to. Because right now, New Yorkers are staring down the barrel of a healthcare crisis. In less than 10 days, families need to start picking their health insurance plans. But for many, their only option is to pay thousands more every single month because Republicans refuse to extend the ACA tax credits. For most New Yorkers, that's $3,000 more a year. How does a typical working family, we're going to hear from some of them, find $3,000? And why is Trump and the Republicans asking them to make the choice? 3,000, 4,000, even more out of your pocket? If you're older, it's even worse. Or have no health care in case, God forbid, you get sick. For most New Yorkers, it's 3,000. But for people close to the retirement age who haven't yet turned 65, it's tens of thousands. The typical couple, 55 years old, who makes about $85,000 a year, will pay $25,000 more in health care. That's astounding. That's enough to bankrupt working families, drain someone's entire retirement savings, or force them to go without health care at all. What a horrible choice. That's why I'm here today, to show you what's at stake. Not with statistics, but faces and stories from real New Yorkers who will be the ones paying the price. And why we're demanding that New York House Republicans stop their vacation and end this shutdown by extending these ACA tax credits before premiums more than double for thousands of New Yorkers. House Republicans are getting paid and not working. Federal workers are working and not getting paid. It's just awful what the Republicans have done. Now, Democrats have said for weeks we're willing to sit down and negotiate and address this healthcare crisis. We want to negotiate lower costs. But Trump is busy focused on things like bailing out Argentina, and New York Republicans are afraid to stand up to Trump, instead of standing, and they're afraid to stand up to Trump when they should be standing up to the American people, for the American people and for New Yorkers. New Yorkers can't afford to wait any longer because November 1st is around the corner. Families are going to have to pick their insurance policies then. It's a crisis and it needs to be addressed immediately. So I'm honored to be joined by New Yorkers who will share their stories of just how devastating these tax cuts will be if they expire. We'll hear more from them in a moment. One of those New Yorkers joining us today is Jeremy Coolish, who lives in the Hudson Valley. Last year, he and his wife paid $392 a month for coverage. You know what that's going up to next year? $1,560, $1,500 plus a month. That's more than $18,000 a year. How are they going to afford that? And we're seeing massive spikes like this in every corner of the state. In rural Plattsburgh, in Congresswoman Stefanik's district, a couple window shopping is seeing an increase of over $20,000 a year. That's a 495% increase from the normal $280 they pay. For an upstate New York family, a small business owner, that spending is going to be crippling. So let me be clear. We've asked Republicans to extend these credits 3 times. 3 times we've had a vote on it, and 3 times they all voted against it. Trump keeps trying to say this healthcare crisis can wait. House Republicans say we can do it later. That's BS. When they say later, they mean never. We all know to them, later means never, as I said. New York families can't wait. Families need to start picking health care in less than 10 days. And New York House Republicans, shame on them, would rather duck and hide than show up to work and tell Trump not to jack up health care bills for thousands of their constituents. So I say to New York House Republicans, come back to Washington. Tell Trump and Speaker Johnson it's time to negotiate. Otherwise, families will go bankrupt, lose insurance, get sick. Don't take my word for it. Let's hear from some of those New Yorkers firsthand. First, we have Jeremy Coolish, who I mentioned. He's a software developer laid off when Trump administration canceled the contract with his company. We have Lila Obregon from Wilson. Lila Obregon Wilson from New York City, a small business owner. Judy Jerome, a New York City personal trainer, and Gene Gazis, a New York City freelancer. Let's start off with Jeremy.
Okay, thank you, Senator Schumer. Sorry, I had to reach the mute button. Thank you for drawing a line in the sand here and standing up for us, protecting our care and our hard-earned benefits. It means a lot. Um, as the senator said, I'm a senior level software developer who was on a long-term contract with the Census Bureau's Open Data Office. It was a great job for nearly 6 years, and it was eliminated pretty much out of the blue in May. And I've found myself in an unexpectedly difficult job market. Long-term white-collar unemployment is a real thing right now. Heard that from a lot of other folks too. So I've been out of work since. This period has been stressful for me in a number of ways. Thankfully, healthcare is not one of them. New York's health plan marketplace and the federal premium tax credits that have allowed me to afford a plan that meets my needs have been a critical lifeline for me. When I lost coverage along with my job, it was the Affordable Care Act marketplace that helped me find and enroll in a new plan quickly and, much to my surprise, easily. It's a really user-friendly site. When I needed it, I got hands-on help to find the plan that best fits my eligibility and health needs. I deal with a couple chronic conditions, and my current plan has allowed me to keep them in check while on a tight budget. But I'm incredibly worried that Republicans will succeed in ripping away the premium tax credits that make that plan feasible for me. As Senator Schumer said before, without the federal help, I would be forced to pay as much as $1,200 a month more, or nearly $15,000 a year in higher premiums. And I would likely have to switch to a much lower quality plan. Forced to contend with sky-high deductibles, co-pays, and uncovered procedures, I might have to choose between managing my chronic health conditions and paying my mortgage. And that's if nothing big goes wrong. Downgrading my coverage isn't just a number. It will have a direct impact on my health and my life, and that of millions of others. So what I'm wondering, for what purpose exactly? Look, I'm here telling my story, so you can imagine I pay a little attention to politics, but I don't get it. Why? So Republicans can score some cheap political points by sticking it to the liberals? Or are they continuing this administration's relentless assault on working families, gutting our hard-earned benefits so that their billionaire buddies can get that fourth yacht? How dare they? I have a feeling that when millions of working-class Americans newly voted Republican because of economic instability and the growing affordability crisis, this isn't exactly what they had in mind. Ultimately, I hope and expect that my need for an Affordable Care Act plan is temporary to hold me until I'm lucky enough to get back on an employer-provided plan. I may be able to pause treatments for the time being, hope for the best, and perhaps emerge unscathed in the long run. But for many others reliant on these marketplace plans and premium tax credits, that is simply not an option. For them, these Affordable Care Act credits are a literal lifesaver. Simply put, the exchange and premium tax credits allow me and other hardworking Americans to get the continuous quality, affordable healthcare we deserve. Thank you.
Thank you, Jeremy. And I'm going to have to run to the floor right now, but we have three other great speakers. We have Lila Obregon-Wilson, we have Judy Jerome, and Gene Gazis. And I will try to return as soon as I come back from the floor, but let's hear their stories. Thank you.
I believe I heard my name. I'm not too sure. Lila Obregon Wilson. I'll correct that a little bit, but I second Jeremy Coolish for Chuck Schumer hosting this event. Senator Chuck Schumer. I've been in New York since 1994. I arrived here on a softball scholarship. It's actually the first time I had insurance since I was little when my dad was pushed out of a corporate job. We weren't on any kind of government assistance. We were just not insured. my mother started working a union job when I moved here, and that actually helped subsidize my insurance that I needed and what was required from the university. Now, as an adult, I have to maneuver the hurdles of being insured as a small business owner and a freelancer. I work in media, and what that means is I work in film and TV and advertising. I'm in my late 40s. I'm lucky I'm a healthy female, but, and I say female because we are required at early on to get certain exams and tests in order to prevent larger illnesses as even at a younger age, but till we get older. These exams continue to expand, and I can't speak for males, but I do know that other exams for them also come up. And I mean, it's as simple as a colonoscopy, for instance. Without prevented care, the outcome possibilities could lead to serious illness, massive bills, and basically inability to survive. Jeremy pointed out that mortgage might be an option that he has to look at compared to when if insurance costs go up. Via New York State, I was able to find the coverage, but the creation of the New York marketplace um, with via ACA, it was the first time I had insurance, and not only that, affordable, good insurance, not emergency insurance, not hospital care only, etc. Though this just changed, this did change in the last years, and specifically when Trump first took office in his first term when he tried to abolish the ACA. And during that, I did experience changes in my insurance and the costs. With his attempts to get rid of the ACA and appease corporate mindsets by opening up the market, I experienced how the fees went up and also how certain benefits were reduced. And this was basically by taking away subsidies that other insurers were getting by joining the ACA market. I actually called to see once, this was 2 years ago, to see what I qualified on non-ACA participating carriers, and there was nothing under $400. Now that sounds inexpensive, but for a person who's freelance, all her life, mind you, I don't have corporate structure support. This is pretty significant, and beyond that, it doesn't necessarily cover everything that the insure that's required once you go get exams or medication and whatnot. Via New York State's marketplace, not only did the number drop significantly, I left brokers who called you